I'm Dr. Mont Cartwright, ophthalmologist, plastic surgeon, and founder of Medical Eye Associates.
I'm Dr. Brian Burry, optometrist and full-time associate.
We'd like to thank you for choosing Medical Eye Associates for your comprehensive surgical and medical eye care, as well as your facial, cosmetic, and plastic reconstructive surgery needs. The mission at Medical Eye Associates is to provide high-quality eye care using today's most advanced technologies available in a caring and down-to-earth environment. Well, I completed my medical school training at University of Chicago in 1985. After that, I moved to Miami, Florida, completed a year of general surgery internship, finally entered into a neurosurgical residency. Interestingly, during my neurosurgical residency, I had an opportunity to work with many of the ophthalmology residents that were also at the university, and I started developing a keen interest in the intricacies of the types of surgery they were doing on the eye. Because of that interest, I completed a residency in ophthalmology at Medical College of Virginia. During that time, I developed an interest in plastic surgery, so I went on to Kellogg Eye Center at University of Michigan and completed a 2-year fellowship in oculofacial plastic surgery. Finally, having finished all that training, I moved down to Central Florida and practiced locally in private practice, ultimately ending up opening and founding a Medical Eye Associates. I'm affiliated with and maintain active staff privileges at most of the major medical centers around Central Florida, including Florida Hospital, St. Cloud Hospital, and Osceola Regional Medical Center. I also have staff privileges at most of the local surgery centers. Now, what's important about this, I think, is that having the access to these centers and their various equipments and ancillary services really is a major benefit to my patients. If I have a specialized procedure that perhaps they might have to go out of town for ordinarily, if I just worked at a surgery center, I now have the availability of a large medical center to provide me with that equipment so that I can perform the best surgery and get the best outcome from my patient. And I think that's a big advantage in this day and age. I can think of a lot of benefits for having a surgical center on site. One that comes to my mind immediately is in the example of a cataract operation. It is standard of care to evaluate that cataract surgical patient within 24 hours to check for any complications. Now, normally that means that the surgeon has to ask that patient to come back the next day, requiring them to make an extra trip. If the surgical center is on site after surgery, I can simply walk that patient over to the clinical side of the center and evaluate that patient post-operatively, thus they don't have to come back the next day for their post-op check. Over to the clinical side of the center and evaluate that patient post-operatively, thus they don't have to come back the next day for their post-op check. I think also that it's very important as a medical director of the on-site center that I can control the quality of care. This means that I have the ability to purchase the most advanced equipment for my patient, keeping up on the high end of technology. And also I can control the staffing, such as hiring good and caring nurses to care for my patients. So I think overall having the surgery center on site has so many benefits. Well, as a multi-specialty ophthalmology practice, we see a variety and are exposed to a variety of different conditions. Some of the more common conditions include cataracts, which block people's vision, requiring surgical removal. We see patients who have the disease called glaucoma, which can damage the visual field and cause blindness. We see children who have crossed eyes and need their eyes straightened. We see patients with plastic surgery problems, such as cancers on their eyelids or face that we can remove and reconstruct. We manage patients and treat patients with macular degeneration. We also see patients with neuro-ophthalmologic problems, and what that means is neurologic problems related to the eye, and again, that's where my additional training in neurosurgery comes in handy. So it's a pretty remarkable place to be able to treat and be exposed to all these subspecialty problems, and we are able to handle all of those problems at Medical Eye Associates. Well, we get a lot of challenging patients at Medical Eye Associates due to our multi-specialty training. I can recall some very interesting cases where we've had high-risk patients, such as young pregnant girls who may have been losing their vision, such as due to high pressure in their brain, secondary to the inducement from pregnancy. And we've performed procedures called optic nerve sheath fenestration, which means I go into the back of the eye, which is pretty elaborate, and I actually make a small window into the optic nerve to relieve the pressure in the brain and around the nerve. I deal with a variety of tumors that involve the brain and orbits, and those can be quite challenging, complex, requiring a set of skills that the average physician may not have to be able to get back behind the eye and remove these delicate tumors that could be compressing the optic nerve. And of course, that's very difficult because as a surgeon, you don't want to cause more damage. You want to treat the problem and make the patient better. We also see a lot of very advanced skin cancers that once taken off have left the patient with quite a deformity in their facial or eyelid area. And with the skills we have at Medical Eye Associates, we're able to remove those cancers successfully, reconstruct them such that the patient has the ability to still, for example, move their face and close their eyelids. So we see quite the gamut of problems at Medical Eye Associates, and fortunately do have the training and skills and facilities to be able to handle these problems. On behalf of Medical Eye Associates, thank you for trusting your care to us.